This episode of Yeah, We're Going There is brought to you by Kindra. Kindra products offer full spectrum relief from vaginal dryness, discomfort, sensitivity, itching, burning, and stinging. Their products, which include vaginal moisturizers, silicone lubricant, and pH-balanced shower and bath gel, are clinically tested and OB-GYN approved. Hormone-free, paraben-free, phthalate-free, and FSA, HSA eligible. Recommended by over 7,500 medical providers and loved by over 330,000 women, including myself, I personally love the vulvovaginal hydration and relief duo and use them on the nights I don't apply my vaginal estrogen. To save 20% off your next order, go to www.ourkindra.com and enter code Dr. Natalie at checkout. I really think you'll love it as much as I do. This is Yeah, We're Going There with Dr. Natalie, breaking the silence on pelvic health for women and men. Yeah, we're going there because knowledge drives better health. Hey everybody, welcome to Yeah, We're Going There with Dr. Natalie. Today we're going to talk about the vaginal microbiome and vulvar health. So, think of the vagina as a garden where healthy bacteria are the good plants that work to keep the weeds or the germs from taking over. The vagina naturally contains millions of bacteria, both good and bad, with the good helping to protect against the germs, the harmful bacteria, from overgrowing. And they do this by keeping the environment slightly acidic. Having bacteria there is normal and healthy, and it is the job of the good bacteria to help maintain a proper pH. The pH range in the vaginal microbiome is typically acidic and should be in the range of 3.8 to 4.5. And this is crucial for protecting against the bad or harmful bacteria. Everyone's microbiome is a little different. And unlike the microbiome of our gut, which is very diverse, the microbiome in the vagina is mainly Lactobacillus. Lactobacillus produces antimicrobial compounds that fill the spaces of the vaginal wall, and they do so to block pathogens from entering. The balance between the good and the bad can change over time, and this is called dysbiosis, and it occurs from things like antibiotic use, hormones, age, diet, hygiene, sexual activity, as well as scented soaps, douching, and unprotected sex. Many things can alter the delicate balance. When there is a drop in the good Lactobacillus bacteria, the potential for bacterial vaginosis or Candidiasis or thrush and sexually transmitted infections, even preterm births, can occur. When dysbiosis occurs, the number of lactobacilli, which are protective, decrease, causing an increase in the pH level, making the area more basic instead of acidic, and allows for colonization of the bad bacteria or growth of the bad bacteria. Douching, a lot of people don't know what that is, so I'm going to explain it. It is the practice of washing or flushing out the inside of the vagina with a mixture. It could be water mixed with vinegar, baking soda, or other antiseptics. And it is an example of what can cause these imbalances between the good and the bad bacteria. This has been well studied and is associated with an increased risk of BV or bacterial vaginosis, preterm birth, and pelvic inflammatory disease, which can lead to infertility. Bacterial vaginosis is really an inflammatory condition, and it's caused by vaginal dysbiosis. And it presents as excessive vaginal discharge that has a fishy smell, with vaginal irritation and a vaginal pH higher than 4.5. BV has been linked to pelvic inflammatory disease, which is an upper genital tract infection that causes damage to the endometrium, the fallopian tubes, the ovaries, and the pelvic peritoneum. And all this can affect fertility. The rate varies significantly by ethnicity, affecting an estimated 52% of Black women, 32% of Hispanic women, and 23% of white women. While white women are more likely to have a vaginal flora that is dominated by the protective Lactobacillus bacteria, Black and Hispanic women, they frequently have more diverse microbiomes with a higher pH, which can make the environment more susceptible to bacterial overgrowth. Candidiasis, which is mostly caused by the overgrowth of the Candida albicans bacteria, can present with symptoms of itchiness, thick white discharge, and pain with urination. Some other causes of candidiasis can include estrogen use, pregnancy, immunosuppression such as chemotherapy, diabetes, and use of broad-spectrum antibiotics. Vaginal dysbiosis, remember the imbalance in the microbiome, has been consistently associated with sexually transmitted infections, including HIV, herpes simplex 2, HPV, and Trichomonas vaginalis, and it's due to the colonization of bad bacteria. So what does a healthy vaginal microbiome look like? A healthy, balanced vagina generally produces clear or white, thin or slightly thick discharge with minimal odor. Aside from douches that we already talked about, feminine hygiene products such as wipes, sprays, washes, and powders are part of a fast-growing industry worth $2 billion in the United States. Family, cultural influences, and marketing have wrongly educated women that the vulva and vagina need to thoroughly be cleaned and fragrant. But all these products and bad habits significantly add to vulvovaginal problems. So, by increasing the knowledge surrounding feminine hygiene, the vaginal microbiome, and poor vaginal health conditions, my hope is that women will be able to make more informed choices about these products and their use to optimize their reproductive health. So, what can we do to maintain a healthy vaginal and vulvar microbiome? I'm going to go through many tips, so pay close attention. First, you have to think of the vagina as a self-cleaning oven. Wash with warm water only. Don't use soap directly on the vulva, which is the outer tissue between the labia. It's external and easily visible. And if you feel like you have to use something, then use Dove hypoallergenic body wash or Cetaphil lotion cleanser, which are more gentle. Ivory, which is pure soap, can cause drying, and soaps with essential oils like lavender can be irritating. Also, aloe can cause sensitivity to many people, so not recommended. Less is more. Avoid using washcloths, sponges, or loofahs, which can all carry bacteria and can irritate sensitive tissue. Avoid bubble baths, bath salts, scented oils or lotions, even gels that contain perfumes, even if they're labeled gentle or mild, they still have ingredients that can be irritated and lead to dysbiosis. When drying yourself, don't rub. Pat dry, or you could even use a blow dryer on a cool setting to dry off. It's good practice to avoid tight clothing made of synthetic fabric. Cotton underwear is better, and white cotton underwear that has no dyes is best. Also, don't hang out in wet or damp clothing like gym clothes or wet bathing suits. Try to always stay dry. Similarly, you'll want to use white, unscented toilet paper and pat dry. And always wipe from front to back. When using detergents, look for detergents that are free of dyes, enzymes, and perfumes to wash your clothing. All free and clear are good products. And never use fabric softener. In terms of feminine products, avoid deodorized pads and tampons. And if you use pads or liners, it's best to switch to all cotton. Remember, don't douche, and avoid feminine over-the-counter creams, hygiene sprays, perfumes, and wipes. If you're dealing with an already irritated and sensitive area of tissue, you could apply a small amount of Vaseline or A&D ointment as a protective barrier. Or some people even like to use coconut oil. And remember to use non-lubricated, non-spermicidal condoms with water-based lubricant during intercourse. The water-based lubricant will prevent the condoms from breaking down or tearing, which can occur with oil-based lubricants. So that's important. Women in perimenopause or menopause need to pay special attention to all these recommendations. Recurrent UTIs become more prevalent as we reach menopause because as estrogen levels drop, the number of protective lactobacilli drops too, creating a more basic environment where the bad bacteria is allowed to multiply and flourish. Using vaginal estrogen can correct and prevent the reoccurrence of urinary tract infections because it helps maintain a more acidic environment where the lactobacillus can thrive and continue to do their protective function. The sad thing is, though, older women have been scared off of using estrogen because of the black box warning that until recently was still on our prescription boxes. And women shied away from all hormones, even vaginal estrogen. And many developed infections, which potentially can progress to sepsis and death. And all of this could have been prevented with the use of vaginal estrogen. I've done other episodes on vaginal estrogen, so feel free to check those out because it can be life-saving. Probiotics, especially those that contain Lactobacillus species, play a crucial role in maintaining vaginal health. They do so by adhering to the vaginal lining, preventing the colonization or the growth of the bad bacteria, and they support a balanced vaginal microbiome. When looking to purchase probiotics, it's important to ensure that they have the best research strains for vaginal health. These include L. acidophilus, which helps maintain a healthy pH and supports the growth of the good bacteria. We can find this ingredient actually in yogurt, miso, kimchi, and tempeh. Another ingredient that we know is well studied is L. rhamnosus, GR1. It's been shown to reduce the reoccurrence of BV and yeast infection. L. reuteri, RC-14, which is often paired with L. rhamnosus GR1, helps support a balanced vaginal microbiome. L. crispatus, which is a naturally occurring strain in vaginal flora, has strong clinical evidence behind it, as does L. gasseri. Lastly, Bifidobacterium lactis has also been identified as beneficial for the vaginal microbiome balance. Scientists have identified specific Lactobacillus strains that, taken orally, can help improve the composition of the vaginal microbiome and reduce symptoms in women prone to recurrent yeast infections. So, probiotics can help restore microbial balance, reduce inflammation, and strengthen genital epithelial, offering a safe, non-invasive approach to managing the dysbiosis in the vaginal microbiome. Probiotics for vaginal health come in both oral and vaginal forms. A double-blind clinical trial found that both approaches, vaginal and oral, significantly reduced BV symptoms with similar effectiveness. This suggests the flexibility based on individual preference, meaning that if one person prefers the oral version over the vaginal suppository, they'll still get benefits from it. The important thing to realize, though, is that oral probiotics primarily affect the gut microbiome, and only certain strains may migrate or indirectly influence the vaginal microbiome through immune modulation. Their effectiveness depends on the strains used and specific conditions present. And as with everything, further research is definitely needed. If you're dealing with recurring infection, it's worth talking to your gynecologist, who can recommend a strain and the delivery method that would best fit your situation. Well, that's a wrap on today's episode. The biggest takeaway here is simple. Your vagina is self-cleaning, and less is truly more when it comes to feminine hygiene. Trust your body. Ditch the products that are doing more harm than good. And if something feels off, talk to your gynecologist rather than reaching for an over-the-counter fix. Small changes in your daily habits can make a big difference in your long-term reproductive health. If you found this episode helpful, please share it with all the women in your life, because this is the kind of information that every woman deserves to have. Until next time, thank you for listening. Take care. Thank you for listening to Yeah, We're Going There with Dr. Natalie. If this conversation helped you feel more informed or less alone, consider subscribing, leaving a review, or sharing the episode. Until next time, yeah, we're going there, because knowledge drives better health. This episode of Yeah, We're Going There is brought to you by Kindra. Kindra products offer full-spectrum relief from vaginal dryness, discomfort, sensitivity, itching, burning, and stinging. Their products, which include vaginal moisturizers, silicone lubricant, and pH-balanced shower and bath gel, are clinically tested and OB-GYN approved, hormone-free, paraben-free, phthalate-free, and FSA, HSA eligible. Recommended by over 7,500 medical providers and loved by over 330,000 women, including myself, I personally love the vulvovaginal hydration and relief duo and use them on the nights I don't apply my vaginal estrogen. To save 20% off your next order, go to www.ourkindra.com and enter code Dr. Natalie at checkout. I really think you'll love it as much as I do.